Welcome back to the Business of Government Hour. I'm Michael Keegan, your host, and our guest today is Dr. Farzad Mostashari, National Coordinator for Health IT within the U.S. Department of Health and Human Services. Also joining us from IBM is Gio Patterson. So, Doctor, technology is just a tool, really, in a sense, but it's a critical tool to foster much needed innovation in entrenched industries like healthcare, which can be perceived as such. Perhaps you could give us a sense, and our listeners a sense, of what we mean exactly by health information technology, and more particularly, what are some of the key components that make up health IT?
Yeah, and also, why we say this, and I think some accept it, and others may be more skeptical. What do you mean? It's critical foundation. Why can't we? People have been taking care of patients with pen and paper for 5,000 years or more. Why do you say that this is the foundation? Look, it is the needs of healthcare and how healthcare is delivered have changed dramatically. We now have many, many, many more providers touching every patient. Coordination of care becomes really much more difficult. And in a 24/7 world with, there's the expectation that information is just going to be available on your mobile phone, on the go, in the middle of the night. And it's no longer acceptable to say, I'll, go back to the office and I'll pull the chart and I'll get back to you. So there's some part of this modernization in healthcare that relates to direct patient care, right? Do I know this patient? Can I learn what their healthcare journey has been? Can I graph their lab values? And can I quickly retrieve that piece of information? Can I share that information with my colleagues? Can I access it if I'm called by the emergency room at 2 a.m? And right now, up until recently in a paper-based world, that was a crapshoot, right? Who's got the chart? Where's the chart? Am I in my other office? Oh, we got to call over for the charts in the other office. I think I remember the patient, right? But that idea, that part of it is the most superficial, frankly, part of electronic health records, turning the healthcare experience into bits and bytes as opposed to scribbles on a piece of paper. The real transformation comes when that data comes to life. And when I write on paper and I close that file, that data is dead. And it only comes to life when the next person opens it, it goes through their eyes to their brain, and they process that information. It is lazy data, dead data. Whereas with electronic information, clinical information, that data can be used to do something like, 1, make a list of patients. So think for a moment about if we lived in a world where doctors and hospitals had a reason to ask the question of all my patients with diabetes, how many of them are under good control and how many are not? How many are under poor control, haven't seen me for the past 6 months, and are not on insulin? If we really want a healthcare system that can answer that question, that basic kind of management question that no retailer could survive nowadays without being able to answer those kind of questions about their customers, right? We can't do that. If we can't do that in healthcare, then we're leaving lives on the table. And that is what we call population health management. Being able to make a list of patients, send them reminders, understand how we're doing to be able to step on a scale and have metrics for our own behavior and to track and improve on those metrics. That, I think, is what really defines the transformative potential of health information technology, making those bits and bytes available. And then it's the promise of the future. It's that once that information is electronic, that we can learn things. There can be associations. There can be the big data and the small decisions that flow from it, the learning that can come for public health, for research, for safety. It's an age of data, and we're bringing that data to healthcare. Absolutely. There are 5 elements in our strategic plan. The first is to increase adoption and exchange of health information. That's the basic foundation. That's the basic nuts and bolts of what we have to do. The second is to draw ever more tightly the connection between those and the outcomes we seek. So the optimization of the technology to get to the goals, very specific goals around reducing inefficiencies, improving quality, improving safety, improving patient centeredness, and so forth. The third is, while we do this, we have to maintain trust in the technology. We have to maintain trust around safety and around privacy and security critically. We cannot take risks. We can't compromise the safety and the trust of the patients in the systems. The fourth is to use the technology not only in doctors' offices and hospitals, the hopefully 0.001% of our lives where we actually spend in care settings, but in the 99.999% of the time that we're not in the doctor's office or the hospital. So to expand the ambit of health information technology to the consumer technology space, to applications and services that can help us manage our health and healthcare finances. And finally, it's to create that framework for innovation and for learning to come. So those are the 5 strategic priorities for the Federal Health IT Strategic Plan.